Much of the musculoskeletal examination focuses on detection of congenital abnormalities, particularly in the hands, spine, hips, legs, and feet. With a little practice, you will be able to combine the musculoskeletal examination with the developmental and nervous system examinations. The infant's hands are clenched because of the palmar grip reflex. You will need to help the infant extend the fingers. Inspect the hands, fingers, and elbows carefully, noting any defects. Examine the infant's hips carefully for signs of dislocation. Two techniques are especially helpful. For the Barlow test, hold the legs as shown and rotate your hands outward, seeing if the femoral head feels stable or moves laterally. Movement of the femoral head signifies laxity and a dislocatable hip. For the Ortolani test, again hold the legs as shown and rotate your hands the other way, inward, until each knee touches the table. A palpable movement of the femoral head back into place is abnormal. It is important to examine the legs and feet to detect developmental abnormalities. Assess symmetry, bowing, and torsion of the legs. There should be no discrepancy in leg length. Some normal infants exhibit twisting or torsion of the tibia, inwardly or outwardly on the longitudinal axis. Parents may be concerned about a toeing in or toeing out of the foot at an awkward gait, all of which are usually normal. Tibial torsion corrects itself during the second year of life, after months of weight bearing. Finally, examine the feet of the infant. At birth, the feet may appear deformed from retaining intrauterine positioning, often being turned inward. Manipulate the affected foot. A normal foot should be easy to correct to the neutral and even to an overcorrected position. You can sometimes scratch or stroke along the outer edge of the foot to see if it assumes a normal position. The normal infant's foot has several features that, while they may initially concern you, are benign. The foot appears flat because of a plantar fat pad. There is often inversion of the foot, elevating the medial margin. The infant may exhibit adduction of the forefoot without inversion, or even adduction of the entire foot. Each of these normal variants tends to resolve within 1 or 2 years. Finally, inspect the spine carefully, making sure there are no pigmented spots, hairy patches, or pits.